We are back on Morning Line. Thanks for joining us. We're talking heart health. You see the number there on the screen, heart disease prevention and the like. This is American Heart Month, tying in perhaps with Valentine's Day. It's a good time to do it and to wear red. Dr. Beckman's with us this morning. I said Ghostbusters. It's a little different name, but you dressed up as him once didn't you?
More than once.
But it's Beckman.
Beckman. But it's so close.
It's so close.
And I'm just as funny as Bill Murray, so it's totally
you are, and you are a doctor. You and Bill would get along great.
I think so.
Well, it's nice to have you on. I really do enjoy having you on. I wish we could have you on more often. We should, because it's always good to talk about this. And we have some folks with questions. We'll take a few of those. Let's go to, I think we have Ronnie first. Ronnie, good morning. Hi, Ronnie.
Good morning. I got two small questions.
Okay.
I got a large heart. My second question, what causes it?
Enlargement of the heart. That was a statement and a question. All right.
That's a really good question. There's a bunch of things that can cause it. One of the ones that we'd worry about most is blood pressure out of control.
Okay.
And so I would suggest that you talk to your doctor and make sure your blood pressure is well regulated, because a blood pressure out of control can first enlarge the heart and then cause heart failure, which will cause shortness of breath and the accumulation of fluid in your lungs. And so I think you're at a point now where hopefully some treatments can make sure that doesn't happen. That's the thing we think about first.
When a heart enlarges, it literally increases in size. Is that, and you would think a larger heart, more powerful, better pumping, but it's increasing what? Because it's swelling, or what's wrong?
So the heart pump, so imagine you have a muscle that's pushing against something that's a bit too heavy for it.
Okay, like bench pressing? Yeah,
that's right.
Too much,
and then what's happening with the constant strain is that the chambers enlarge, and the muscle gets a bit thicker, but not as much as the chambers are enlarging. And so the heart has more blood in it, and it's pumping less effectively.
Okay, but it's different. If you're working out and you've got guns, and that's okay in your arms. You don't want that in your heart.
Right, but your heart's going 24 hours a day. I'm only lifting, 2-3 hours a day.
I see. So an enlarged heart then, though, typically then is a sign that's not good. And it's something that needs to be looked at.
It's a strain.
Could anything, I wonder though, can athletes get enlarged hearts that are meaning healthier, meaning that, someone like LeBron James's heart, now he's a big human anyway, but that his heart, because he runs up and down and jumps and is an incredible athlete, is bigger and stronger than, say, mine? So, aside from the genetic, obviously, he's bigger and taller than me.
So besides the body size difference, chronic athletes who do a lot of aerobic activity, and even athletes who do lots of lifting, they do have somewhat bigger hearts. The aerobic activity athletes, the people who are running up and down the court or running as part of their sport, or hockey players, for example, they do have some positive enlargements of their heart, but that's not the same thing.
Okay.
Their hearts are much more efficient and have the ability to increase the amount of output very quickly, in contrast to the folks who have an enlarged heart because they have, say, long-standing high blood pressure. They really can't accommodate big changes in activity as easily at all.
All right. And when you have a healthy heart, and an athlete that's running up and down the court, his heart's beating really fast, or her heart's beating fast. Resting heart rate, if it's slower, would that mean they also then, their heart can slow down and with less pumping get the blood everywhere it needs to be because it really squeezes?
So it's a combination of things. One of them is that your heart is more efficient, but it's also true that the rest of your body is more efficient and needs less blood. And so for example, with lower blood pressure, it's not as hard for the heart to pump and get blood around.
Makes sense.
And so a lower heart rate is a good indicator in a normal situation of better heart health. Now, there are some people that have slow heart rates, and that's not a good situation. And if it gets too slow and they faint, they may need a pacemaker.
Gotcha. Let's see what Bob had. He had a question about heart beating. Bob, good morning, Bob.
Good morning. I'll be 65 this year. I'm concerned I have a little trouble with my diastolic heart pressure, if you could explain that a little bit.
Yeah, when you get systolic and dystolic?
That's right, you get the systolic, so there's two numbers.
Okay.
The top one is the systolic, the bottom one is the diastolic blood pressure. And you can think of it this way, the diastolic blood pressure is sort of what your pressure is all the time. It looks at blood vessel stiffness, and the systolic blood pressure is when your heart's pumping and increasing the amount of forward pressure in the tubes, in the blood tubes, right? So diastolic blood pressure is important. It's a marker of stiffness. It's an equal predictor of all the bad things like heart attack and stroke. And it tends to be higher in younger people, and then it begins to go down as we get older. If it remains high, though, it's part of being treated for high blood pressure.
Okay, and when you go, what's a normal blood pressure for, say, an adult male? What would be the range?
The current recommendations from the American Heart Association are under 130/80.
Okay, 130/80. And it does seem to me, and I have several friends who are a little elevated that have been put on medicines. Now, you can lower your blood pressure through exercise and diet like you can with cholesterol, but those medicines seem very effective as well. It seems to really control their blood pressure.
It's just like everything else, right? Sometimes we are the product of our parents, and you're not going to escape the genetics of your parents. But you can modify those outcomes a lot with your behavior, and so better diet and more exercise can lower your blood pressure and improve your cholesterol. But sometimes, even though you do all the right things, you don't get there.
It's because genetics. Some people are just predisposed.
And it's for the same reasons that you're good looking and smart, your cholesterol may be high.
Yeah, you can't control it. It's just the way it is.
It's just the way it is.
And with any of the blood pressure meds, were there some reports that any links or anything to cancers, things along those lines?
No, the cancers, not for any of the blood pressure medicines that are available now. There's a smidge of a link with diabetes, but it's not really. It's more, for example, with some of the water pills, if you concentrate your blood, there's a little more sugar in there now. But all of these medicines, the benefit of them is much, much greater than the bad effects of them. Now, every now and again, people don't tolerate a certain medication. Fine. We have a million others.
That's the beauty of it.
That's right.
Bunch of different types of statins, and even if you can't handle a statin for lowering cholesterol,
there are other medications. There's a medication called ezetimibe, which is another kind of pill, and then there's some injections that are available now. My guess is in the next few years, there's going to be medications that may last like 6 months with one pill.
Oh, really?
We're getting to that point.
Wow, that would be awesome, wouldn't it? It would mean that it just stays in your system, or it's absorbed by the fat or something, and then releases slowly over time.
That's right.
Holy cow. Now, we do need cholesterol in our body, do we not? Does the brain not need it?
Every tissue needs it. It's part of the cell membrane, for example.
Okay, so could there be questions about, to the point where you lower your cholesterol so much that it has an adverse effect? So
it turns out that this has been studied. There was a very large study that gave people a high dose of Crestor, actually, and some people had cholesterol, the bad cholesterol, the LDL, down to 0.
Wow.
And they had it for months at a time. And you know what happened to them? Absolutely nothing.
So it worked fine.
It worked fine.
Well, but you never know. Down the road, does that have an effect on your brain or something like that?
Well, they were lucky enough to have fewer heart attacks and strokes. That was a good thing.
So they're going to live longer, right?
That's right. And actually, even though there's some reports that people may have like name-finding difficulty with the statins, that's what people talk about. It's also equally likely that you are preventing the vascular dementia that some people can get.
Yeah, that's what I was going to say. I've heard it both ways. You could say a statin maybe is worth taking even if you don't have super high cholesterol, to just limit the potential for hardening of the arteries in your brain, which will make you forgetful as you get older.
That's right.
My parents are dealing with that right now. That a little light vascular that we probably all, if we're lucky enough to live that old, are going to probably suffer from.
That's right.
And so maybe a statin could help.
I think so. One of the ways that people can figure out for themselves, if they want to consider it, is that there's a risk calculator that's available online.
Okay.
And you could put in the AHA, ACC risk calculator, and it'll come up. And it's going to ask you really simple questions. Man, woman, what is your blood pressure? What is your cholesterol? What is your age? And it'll give you an estimate of your 10-year risk of things like heart attack and stroke.
That's on the American Heart Association website, did you say?
Actually it's a joint website between the American Heart Association and the American College of Cardiology. It's great. It was jointly developed.
All right.
And if you want to check out your own risk, do it.
That's a good idea. All right, let's go to Buzz. Buzz, good morning. Hi, Buzz.
Hey, how are y'all?
Good.
That's great. I was just turned on the show and I heard you were talking about cholesterol and so forth. My experience was in 2003, I was admitted to the hospital after taking Lipitor for pancreatitis. So I did not realize that it might be the Lipitor that was doing the deal. So in 05, I had continued doing it after the healing in 03, and I got admitted again. I thought at that time, there's something wrong here. I'm going to stop taking that Lipitor. And I started taking niacin. I take 500 milligrams a day, three 500 milligram tablets a day. Can I say the brand name?
Sure.
Nature's Bounty. I take 3 of those a day at the same time. It says it's flush free, and I just had my latest cholesterol test, and I was within normal range, and I've been doing that ever since 05. I don't take Lipitor anymore.
Wow, yeah, niacin must be time release, because I've had a flush before from that.
Oh, yeah, no, it can make you feel like you got a sunburn.
Yeah, yeah.
So, again, some of your callers are unique. That's not a very common side effect. In fact, in 20 years, I've never seen that.
What site, meaning that niacin lowered it that much?
No, the Lipitor and the pancreatitis.
Oh, I'm sorry, pancreatitis.
But
okay,
I'm happy. So I'm happy for him that the niacin is bringing him back to the normal range. It probably wouldn't be the one that I would start now. It's fallen out of favor a little bit.
Niacin has?
It has.
How come?
Well, when it was studied originally, more than 30, 40 years ago now, it had modest effects. And when it was studied as an add-on to the statins, it didn't do anything. Again, it's not harmful. It's a B vitamin, right? But it's not, if you're going to be taking medicines, you might as well get the bang for your buck, so to speak. And there's a lot of generic medications that'll get you where you need to be.
Yeah, right. And if that works for him, more power to him. Especially since he was on Lipitor before.
That's right.
Listen, we'll take a break on that note. When we come back, we can take more of your calls, more of our conversation with a good doctor here as we're talking heart health on MorningLine right after this. Stay with us. Yeah.
Storm 5 weather update.